Hello, and welcome to Conversations from the World of Allergy, a podcast produced by the American Academy of Allergy, Asthma, and Immunology. I am your host, Rebecca Sapp. I am a board-certified allergist and immunologist and a fellowship director who always enjoys learning more about the exciting field of allergy immunology. Our podcast series will use interviews with thought leaders to keep up to date on new developments and to review core topics. Today's edition of our Conversations from the World of Allergy will focus on connecting with our patients and using motivational interviewing to help us work towards shared goals. We are pleased to welcome Dr. Ariana Chiu. Dr. Chiu is a professor of pediatrics and medicine at the Medical College of Wisconsin. She is the medical director of the Asthma and Allergy Clinic at Children's Wisconsin and the chief of the allergy section at the VA Medical Center in Milwaukee. Dr. Chiu is also my co-chair for the Chrysalis Project, which helps to inspire the next generation of allergy immunology physicians. She's been a fellowship director, division chief, and has helped so many patients over the years. Given this, I couldn't think of a better person to talk with about how to better connect with our patients. Dr. Chiu, thank you so much for taking the time to join us today.
Thank you, Rebecca.
I'd like to start just by getting to know you a little better. Can you tell us a little bit about yourself and include something outside of medicine that you like to do?
Okay. Well, one of the things that really connected me with allergy immunology is the fact that we can see kids and adults. I absolutely love that, being able to have a 8-year-old, 18-year-old, and 80-year-old all on the same day. It just really brings a lot of variety and love being able to actually see whole families. So that's definitely one of the things that excited me about allergy immunology. I also love the fact that we see very common conditions like, allergic rhinitis or hay fever, asthma, and then, of course, just some unusual conditions that affect the immune system. So all those things really excited me about allergy immunology. Maybe just some things about myself. We love to travel. I love reading mysteries and police procedurals. And my children tell me I do too much streaming and watching and consuming of media, but that's what I do while I'm doing my charting. So that's kind of my excuse.
It's good to have it on in the background just as a distraction.
Exactly.
Yeah. What's a great book you've read recently?
Wow, there's actually a lot of different series that I like to read. I'm not so much a nonfiction, but there's also been some really good nonfiction books. So you're putting me on the as pressure. So I don't know if I'd be able to say anything, but kind of reading actually right now the Slow Horses kind of series from BBC in Britain. So
Okay, I'll have to give it a try. I do like a good mystery novel, so. So it sounds like, you gave all sorts of good reasons why we love allergy immunology, but what originally brought you into the field?
I have to say it was being able to see children. I came into medicine thinking I was going to be a pediatrician, thought all those sick kids were kind of sad to see, and then found out that with allergy immunology, you can see both kids and adults. So that really is what brought me into the field. And then I've just loved it. And no looking back, I just really enjoy. And again, it's really fun because I will now see, I'm going to age myself, children of the children I saw. So that's just wonderful to be able to make those connections.
Yeah, it is really fun to be able to see the whole family, I think.
Mhm.
And the variety in the day makes such a big difference.
Yes.
Having to take off my, adult hat and put on my how am I going to engage this 4-year-old makes a big difference.
Exactly, exactly.
So we want to talk today about connecting with our patients. So being a physician can often lead to these really challenging conversations with patients. It seems like it's even getting more challenging over time. What types of conversations do you find are the most difficult to have with patients?
There's probably a couple of them for me. One is maybe even convincing somebody to take a medication or do some kind of treatment when, first of all, they may not even believe or understand that they have that condition. And then, in addition to that, even if they do believe it, sometimes getting over the challenges of trying to make sure that they realize maybe the medicines and treatments are safe, and that they need to use it consistently if they really want to get better. And I did forget to mention in the beginning that one of the things I really enjoy about allergy immunology as well is that we're really able to improve quality of life. And I think that's really important because we want to, maybe they're not necessarily life-threatening conditions. Some of them are, but maybe they're not. But if they come back and go, oh my gosh, my rash is better, or I can actually breathe out of my nose now, those things that we can improve the quality of life really make a big difference for me as well. So trying to convince somebody those kind of things can sometimes be challenging.
Absolutely. And then establishing rapport when patients first come in is often kind of the first step in really establishing that therapeutic relationship, what are some ways that you try to put a patient at ease? Maybe the first kinds of questions you ask them to really start to get to know who they are and to establish that relationship.
Yeah, that's always really very, very important. So I do try to do a little bit of chart review ahead of time just to find out, where are they coming from? Again, if they're a certain age or grade, I like to make that connection of maybe if they are in the younger population, pediatrics, like what kind of activities they like to do, whether it be sports or not. If they're maybe older, have a family, I love to ask them besides jobs and occupation, just kind of the things and hobbies that they enjoy doing and family members. And one of the things we all hate the EMR, but I love that Epic actually has the little sticky notes. So then I always write these little dates like when they got married, when they had their first children. And it's funny because they all go, wow, you have such good memory. And I always say, no, I actually do write it down. But I think that that really does help to make that connection and be able to kind of like you said, just establish that relationship so that if I am going to say something that may be a little bit more challenging or something that may be a little bit conflicted, then I think that they know that I'm coming at it from a perspective that really has their best intent.
Yeah, and I think that this allergy immunology being this kind of longitudinal relationship that we have with patients, having those facts about, hey, how was graduation for your grandson? Or,
Mhm.
congratulations on getting to third grade makes such a huge difference.
Yeah, I agree. Completely agree.
We all know that mental health can be a huge challenge in worsening symptoms, but also in just sometimes patients don't realize what an impact that it may be having on their health. And there's all these great data to say that, if you're having anxiety, it can make, asthma worse, all of these things. But oftentimes a patient is a little bit resistant to the idea that maybe that's playing into their illness. How do you address that? How do you introduce that idea? And how do you get someone to kind of bring that into part of the care plan?
Oh, that is really a very great question, too, and one I've been kind of thinking about because what I try to do is, unfortunately, there still is a stigma about mental health and really to try to take it away from something that's lacking or a weakness. And actually, since COVID, what I've been trying to do is I'll even bring up COVID brought up a lot of things that we realize in our society. And unfortunately, anxiety was one of those things. And then I try to use that to incorporate, hey, have there been things going on that have made you maybe a little bit more anxious? Very understandably, but that it can impact, like you said, Rebecca, kind of our both our care, sometimes medications with side effects, whether it's kind of vocal cord dysfunction, as some of our asthma patients may actually have some associations with all those things can really be play a role and be very impactful on it. But I do try to make sure that I'm being very sensitive to bringing it up. And sometimes I might even say, hey, if it's my first time meeting them, I might say, hey, it's my first time meeting you, but I just kind of want to bring this up. I hope I'm not, going to offend anybody. If it's someone I've known for a while, I think we are able to kind of chat about things because we've been through some of those ups and downs of their life and family and personal things. And we know that stressors play a big role. So I really do try to incorporate that too.
One thing I've been trying to incorporate is this idea that when someone's had an allergic reaction, that can almost be a PTSD
Yes.
like recall. As soon as they start to feel any symptoms, they immediately start thinking, "Oh no, what if this is going to happen?" And bringing that in, and sometimes that can help them realize, "Oh yeah, maybe that anxiety and stress of my prior history is actually really playing into why I'm having such dramatic symptoms now."
Yeah, no, that's really very key. I think we've become much more aware and even offer to our patients now and families this idea that if we can have some kind of a support to kind of really address some of those concerns, and again, make it really acceptable that this is not just you or your condition, but really a lot of people kind of go through it. And one of the things I'm really happy with our program is we have, of course, it's Wisconsin. We have to call it a cute little name. It's called the Farms Clinic. So it's like a food allergy resource management and support clinic, and it incorporates actually having both child life specialists and medical psychologists to kind of address those concerns. That anxiety can play a big role, and depending on that stage in life, can really affect things too. So that's definitely something I try to bring up. And then other conditions, again, when we talked about the vocal cord and paradoxical vocal fold motion abnormalities, or now I think they like the term inducible laryngeal obstruction. So it's always nice to kind of be able
Really?
to work with our colleagues that can offer some of the other treatments, not necessarily medicines, but more like speech therapy and just breathing techniques, all those to kind of really bring in the fact that this is kind of the whole body that's being affected. And we want to address and support all those things.
Yeah, I think there's more available for kids these days. I think it's becoming more recognized. We also, in our food allergy center, have a psychologist who helps to work with our patients because we know what a dramatic impact has. It seems like there's less resources available for adults. I don't know if you've found that or if there's resources that you've turned to that have been helpful.
I agree. I think, unfortunately, we know again that mental health issues are really kind of at a crisis right now, and being able to offer that support. But we are able to give them some resources. And then I always ask the patients and families too if they do have other places, and whether it's actually a mental behavioral health, therapist versus actually even maybe church or their faith base or other kind of support groups too. I think are also really important as well.
When a patient is more dismissive to your recommendations, how do you try to respond to the things you found helpful and kind of bringing someone in?
Yeah. Yeah, there are definitely some times where you will get that kind of a response. And I, first of all, always try to make sure that I am respectful of their perspective and point of view, because again, this is whether it's a medication, whether it's a treatment, it's something that they need to really buy in and decide whether or not they want to do it. And so I definitely want to provide that kind of a perspective that I'm, doing this from a respectful manner. But there will be times, I know I've gone through it, I'm sure we all have, where the person just gets literally upset, almost kind of like in your face. And I think I just always have to kind of remind myself, I want to make sure that I'm not bringing in something into that interview or that discussion that's my baggage. And then I also have to kind of remind as well that, I don't know what they just came through. Maybe parking was horrible, there was an accident, something was going on. So I really try to, bring that up, maybe even mention that. Again, we're always very careful too. We just don't want to have a situation get so escalated and you don't want to feel safe in the environment. But usually, if I can try to, come around and say, I understand that you might be going through this. Please let me know what it is that I can help you with. Usually you can come to terms and get to kind of an agreement. But there might be times where I have to kind of do the rescue page or step outside or something like that just to refocus myself. And I think that it's okay for us to do that if we do feel that something is, getting to a point where you just don't want to, no return. Let's put it that way. So, but thankfully, those are few and far between. I think most of the time, and maybe we as specialists, because maybe we are the fourth person or the fifth person to tell them that they need to use their medications consistently or they'll end up in the ER. I certainly hope that there are times that they may be a little bit more open to kind of the discussions that we have, as long as we approach it in a respectful manner.
Yeah, certainly. Oftentimes, our patients, I live in Boston, and our patients are coming driving through traffic in Boston to get here. There's construction going on at the hospital. Parking is a mess. And so I
Mhm.
think by the time they get up to the clinic, oftentimes they're pretty stressed just from that. Their blood pressure's a little higher. And so I think taking a few minutes to be like, I am so sorry. It is terrible to try to get down here. Thank you for coming in. I know that it's a inconvenience to come all the way down here. Can sometimes be really helpful in kind of
Yeah,
establishing that.
exactly.
Yeah. So, what if you have a patient who's convinced of a specific diagnosis, that they're convinced this is the right one, and you're not convinced, and you're having a hard time conveying it? What are Is there any techniques or anything that you found helpful in kind of really helping to bring the patient more to look at it from the way that you're looking at it?
Yeah, that's also a great question. I can think of some specific conditions that we all see. And one of them I'll just really say, if you've had some kind of significant lab workup and none of the laboratory findings are suggestive for this particular condition, I try to approach it from, this is actually reassuring that you don't have it. I understand that maybe you wanted a diagnosis or something to hang your hat on, but I try to use the perspective that, even if it's not that disease or disorder condition, we can certainly try to treat it and maybe at least help through, the symptoms. Again, try to help with kind of, let's say, even the quality of life. But I really do try to reinforce that, we're dealing with evidence-based medicine, and I know that whether you look at Dr. Google or you may search for other providers, they may come up with other kind of conditions. But I'm always really careful to say and try to get that perspective of, we really want to deal with the condition that it actually is or is not. So I also am very careful about trying to be pushed into a diagnosis that is not the actual diagnosis. Now, the other day was interesting. I came in thinking, oh no, this person came in with a whole bunch of labs that were obviously very alternate based, pseudoscience, and was expecting to get a very different kind of approach, because I think they were looking for a treatment, or at least the other provider that referred them were. And actually, this guy had a very, again, tells you kind of like what we are expecting when we go into the room. He actually was very open. He said, nope, he knew he was going in kind of from an alternative medicine perspective because he was trying to just figure out what his condition actually was. He was just very thankful that I was willing to even approach his condition and maybe do a whole workup that was more evidence based and try to look at it from an immune standpoint. It was very, again, eye opening for me. Sometimes when we go into a room and you're just not sure what to expect, it may certainly be a different kind of a process. And so I think being open minded is still going to be very helpful for those kind of cases as well.
That can be sometimes really difficult if a patient has paid for labs out of pocket that
Mhm.
aren't well validated, and you have to try to tell them, actually, these are not tests that we send because there's really not great evidence behind them. And I don't know what to do with the information that they're giving us because of that. And you feel bad because they've often, again, paid out of pocket for this, but they really should know what the tests are used for.
Yeah, exactly.
Yeah.
Exactly.
Are there questions you ask about kind of the background in patients' lives to better understand who they are and how you can connect with them, or other factors in their life that might be playing a role?
Yeah, I think I really do like to know what's going on in their home lives, as well as, again, things that they feel bring them joy. So, hobbies and activities that they like. And one of the things, nobody liked COVID, but maybe the silver lining was when we'd have to do some of those Zoom meetings or home visits, and you can actually see them in their environment. I always thought that was really kind of cool to kind of just see their home and kind of how it's decorated and maybe other things that they might have there, sometimes the clutter. So that was actually a good thing that you can kind of bring up to for some of our allergic patients. But those are the ways I do really try to, again, make that connection that we talked about so that I can understand. I've had patients, I'm sure we all have, they are juggling two jobs, and like three or four children and their own health, and then really trying to figure out whether or not, they can do one child's medication, let alone, all of their medications. And so I think those are things that we as healthcare providers and specifically allergists and immunologists need to be aware of, because that really can impact our patients and whether they're using the medicines. I think a lot of times we jump to, oh my goodness, you're not doing your meds. You're not doing a good job, or you're being a bad person, which I always try to make sure that they realize there's no judgment at all. It really is just more trying to figure out, what can we do and what resources can we help to offer about, doing the medicines and things like that. I mean, there are times when I'll say, you don't have to do them. Even when we say twice a day, it doesn't have to be 12 hours apart. It could be breakfast and dinner or some kind of derivation there that just works with their own schedules just a little bit easier to make it more convenient so that they do remember, so that then again, the medications can be given. And again, the whole idea of really trying to understand and help them understand the why behind the different medicines, I think is always very helpful, because then they're better understanding of what's the controller versus the reliever and those kind of things is very helpful too.
Absolutely. I actually one time told our dentist, who, I have 4 kids, and when my youngest was about 2 and a terrible sleeper, the dentist told me that I really needed to floss all my children's teeth, and I looked her right in the eye and was like, "No, it will break us." And so And now when I have a patient, who has multiple kids in the room and we're talking about, environmental allergies and all these things that I'm hoping that they could institute to help, and sometimes I just have to look and be like, it would be great if we could do all this. Let's really focus on medications right now because I think this is not going to be doable. And I can appreciate what life is like with the kids and work and how that
Yes,
is. My kids do
exactly.
floss their kids now, teeth are now, but there was a time when that was just too much for us.
I love it. That's great. That's good.
So I wanted to talk a little bit about motivational interviewing because it's a technique that I think can be helpful. And it's often used to help to really engage patients in their care so they really take ownership. Is this something you're using or have used and found helpful?
I actually do think it is helpful. I mean, I'm not probably the person who knows all the correct verbiage or maybe follows the exact, whatever process. But I think that it's helpful because you really want to know what motivates the patient, really. What is it that can be encouraging to either do the medication, find out why they're not doing it? So I think it's very, very helpful. I think one of the biggest things is talking about, like, let's say, open ended questions, right? You don't want to have those yes no questions because then you can get grunts from the teenager or you can like get nothing from the patient back. So I think that's always something that's important. I know I try to make it a game with my younger patients, but I even say it to my older patients. I'll say adults, I'll even say, hey, here's that picture of your inhalers, remind me again of how you're using these medicines. And I joke that, you know me, it's Dr. Chu going to ask you this question every time, but I think that they get used to that. And again, I always really say, I know and understand life happens. So I get that you're not going to be doing it, maybe 14 times in a week. So just tell me how often you're doing it. And so that's what I really try to incorporate with the patients and find out how often they're doing things. And then if they are doing it, like, let's say, at a certain level, what can we do to try to make it even more successful in trying to get them to being closer to, let's say, 14 times a week if it's a twice a day medicine, et cetera, or even if it's a once a day medicine, being able to do it at least 6 or 7 days out of the week as opposed to maybe the 3 or 4 days. And we hear the response as well, it's summer break and I'm out of my routine from school, so that's why weekends I tend to forget things or whatever. And then I really try to incorporate what they're doing kind of in their day to day so that we can better encourage and really remind them of when they may need to use medication. And it's surprising sometimes when you find out what is that actually motivates them or not, and you're like, oh, I had a completely different set of expectations of what I thought was going to be, you need to do this because of this goal. Their goals can be completely different. So
Absolutely. What are some things that you recommend in terms of helping patients remember to take medications at certain times or linking it with certain things? Are there techniques you found?
yeah, and it's interesting because depending on the age of the child, if it's a young one, if I even see that they have a phone on hand, I'll be like, "Oh, look, you've got a phone. It's a smartphone. Maybe we can set up some of those reminders for you, whether it's on the phone or even just physical reminders. Since we want to make sure that the kids are actually, rinsing their mouth out after they use certain inhalers." Putting it by their toothbrushes or some things like that to try to help them to kind of remind them how to do it. I'm also really open, and I always tell the families, since life happens and I get that you may not be doing it consistently, I'd rather you be honest and tell me what you're doing because I don't want to keep adding more medicines. That's just going to make things more overwhelming and not get done. So we'll work with what you actually have and try to optimize what you're doing there. And so there'll be times when I'll say, okay, as opposed to we'll pick the inhaled steroid. Instead of doing it 2 puffs twice a day, because that's what everybody decides, let's do all 4 puffs once a day. And then you can help me determine, is it morning when it's like when you prefer to do it, or is it more in the evening, depending on, bedtime routines or trying to catch the bus, what is actually work better for you. So I think that that's actually made a big difference for them to kind of choose also when would be the better time that they can do things. I actually had one adult who said, I'm going to do it in the car. I said, okay, if that's when you remember to do it that once a day. Let's do it in the car, understanding that he may not rinse his mouth out afterwards, but at least you're going to try to get to that point where they would be a little bit more consistent. So being flexible, I think from that standpoint is also really helpful too.
Maybe not while he's driving, but when he
Yeah.
gets in the car. No, I think that's really important because, we're making our decisions based upon how we think patients are responding to a medicine that we think they're taking and how often they're taking it. And if we are just going to pile on something else because, well, it doesn't seem like they're responding, but it actually turns out that they just can't manage to, remember to do it, or even they don't really like it, but they don't
Yeah.
want to tell you that. And then we add on more things that aren't helpful. So I like that really kind of no judgment. I need to know what you're doing so I can make the best decision to decide on next steps. So,
Yeah, and it's funny that you should say that. I remember having a young, probably preteen kid, and here I was thinking that he would probably say, "Yep, I'd rather focus on my asthma and do my asthma inhalers as opposed to the all the nose sprays on top of it." He's like, "No, what I really want to do is breathe out of my nose." I'm like, "Oh, okay." So then did end up focusing on the nasal and allergy medications. Another one that kind of again just kind of realizing where their patients and families are coming from compared to us. I think I remember thinking to myself, thinking that, oh, the families are kind of a little hesitant about the inhaled steroids, even though we know it's safe. So maybe they'd want to back down on the dose of the inhaled steroid. And then the parent actually said, no, I think I'd rather back down off the pill because that's less a copay. I'm like, good point. I never even thought of that. So again, really understanding where the patients and families are coming from is so helpful. So
yeah, sometimes we don't think about too the copay for the different medicines and that maybe they really aren't taking it because actually they don't want to tell us that it's too expensive
mhm.
and they can't manage that, which is a very valid concern.
Yep. Yep.
Um, what types of questions help to draw out a patient's motivation?
That's a great question too. I think when I actually say, what is it that you would like to get out of A, the visit, or B, what is it that you really want to do? And I'm just going to use, let's say, the teenagers, because sometimes that's a little bit easier. They might say, hey, I want to be able to be in my sports after school and be able to not have to use my rescue inhaler. I want to be able to go through and play a soccer game and not have any problems. So I think trying to understand what it is that they would like to get out of the medication, again, what part of their quality of life or what part of their life that they want to have some of the improvements on, I think is very, very important too. And then maybe it is an adult person. It's just like, hey, I don't want to get up in the middle of the night, So trying to address some of those questions I think are helpful in then maybe determining your next steps in either medications, backing off medications, or whatever to try to help what works for that patient.
Is there a time when you've had a difficult conversation and it's just ended really successfully, somewhat surprisingly to you, that you can think of? And what helped to make that conversation more successful?
Um, that's funny because I think it probably was the one that just I mentioned earlier with the kind of non-evidence based labs and just trying to address kind of some of the concerns. I was kind of expecting to be a very I was expecting to be very defensive going into the appointment, thinking that this person's not going to like what I have to say, and but I had to be firm in believing whether or not this is a real condition or not. And I think it was something that was quite surprising because, that patient actually said, no, I completely understand again. And I'm just grateful that you're even listening to me because it sounds like they were getting a little bit more, maybe not being heard from maybe other providers. So that was always good. That was a good example. But then there's also the ones where when you make that final connection of, hey, do you feel much better since you've been taking this medicine consistently? Are you able to play your sports now and get by and be able to do this? And then all of a sudden, that aha moment, I like to call it that, where it's like it clicks and they go, now I understand why you're always writing me to use these medicines or what have you consistently. That really just brings joy. And you just when you make that connection, and it makes that whole visit very, very a good one. Let's put it that way.
Yeah, I think sometimes maybe patients don't even remember what they were like before. And
Mhm.
so sometimes saying, oh, I wrote here that, you're not even able to get through a soccer game without having to pause and use your inhaler. Have you had to do that in the last month? They're like, oh, you're right. I haven't had to do.
Mhm.
I guess it is working. I guess it is helping. That makes that kind of click and that
Yeah.
difference in the conversation.
Yes, definitely. I think it's one thing I find with even like say the allergy immunotherapies or the allergy quote shots that maybe patients are on. And I think a lot of times they all think, oh, I want to get off all my meds. And some of our patients are successful enough when you do the all of the meds and no longer need to be on it. But others, I'll just have to step back and go, hey, you are still on medications, but you had less antibiotics than you've had before, or you're now able to stay at that family member's holiday party and not be so symptomatic with their pet at the home. And then it is, I'm like, oh yeah, that those are really good things. So yes, those are kind of ways to kind of mark that things are becoming that are they're improving and then they are successful.
So, if you have a patient who's come in kind of with a specific agenda, for example, they've seen a medicine on TV and they really want to start it because they think it's going to be really helpful for them. They don't like the medicines they're on, but maybe that's a really expensive medicine and not necessary. How do you start to kind of build that alliance with that patient to make the decisions that's good both for, we'll say on the public health side, but good for that specific patient as well?
Yeah, that's also a great question because one of the things with direct to consumer, advertising is that, and I think that it does help to bring up an awareness so that if they kind of say, "Hey, I just happened to see this new medication. Is it something for me?" And most of my patients come in with that attitude. They're not necessarily, "I need this," but sometimes it happens. And then I just really try to discuss with them that. First of all, we need to make sure that we optimize what you're currently on. And whether it's, I might say, hey, this is an inhaler or this is a pill, as opposed to an injection that you'd have to use fairly consistently, because a lot of the newer medications we're probably talking about are more the biologics, and they are kind of more injections. And I'll explain at some point we do need something like that. We certainly can look at that again, but I think it's actually good that you're not at that level where you need to be on something like that, and you've been actually doing really well with these particular kind of more routine inhalers, for example, that you're on. And we'll just kind of work with that in that kind of a standpoint. Now, as you can imagine, we definitely have some of those patients where, whether it's they haven't really consistently used their meds, so then they're in the hospital or in the emergency room, unfortunately, and then they see some of these advertisements. And I'm still probably struggling myself that I still think that it's important to be on good daily medicines before trying to reach for some of those more expensive biologic treatments. And I just try to utilize the idea that, if we don't need to be on those and we just need to be consistent with what you're on so that we could prevent you from going to the emergency room or get admitted, I think that's far better for all of us, as opposed to just going right to kind of one of those stronger, newer medications.
Absolutely. And sometimes it's so hard because different patients have such different goals and expectations. Some patients want the least medication they can possibly be on, and so you're trying to maximize what you can get them to take. And some people want the biggest gun that they can have to really get things under control. And sometimes finding that middle ground or figuring out what they're looking for can be really difficult.
Hmm. Exactly.
And do you have kind of keys that you look for that maybe the patient isn't feeling heard or doesn't understand what you're trying to tell them?
I think sometimes if you look at just body language and expression or lack of expression, that may be helpful. But there are times too, again, we have our own expectations coming into it. And so I do definitely look at whether or not they seem engaged, whether or not they're not on the device while we're trying to talk to them. Those are ways that kind of help me to see whether or not they're feeling heard. And I might even say, if we're trying to come to terms about a medicine that maybe there is a little bit of a conflict or a challenge, I might say, hey, do you mind? This is an important part of the conversation. If we can actually have less distractions and maybe we can kind of have that kind of more, face to face time to interact and discuss this. But again, try to be sensitive because maybe it is something that they have to find on their phone of an appointment for a child that they're, trying to pick up or somebody that they're kind of reflecting on. So I think that that's key. And then I also have to remind myself that I come in with certain expectations or maybe biases. I had one mom just the other day, and she was making kind of a funny face. And I remember going, why is she making this funny face when I'm talking to her? I literally later on kind of thought to myself, I wonder if it was very difficult for her maybe to hear. And so she was making a face, but she was concentrating on what I was trying to say. But I just had to kind of remind myself because at first I was a little taken aback by that. And then I went, oh, I think that that's actually what's going on. And then just kind of had to refocus and make sure that I was being clear in what I was trying to communicate to this mother.
Yeah, especially when we are all in masks, it can be so difficult for some of our older patients to hear. And so even just getting not the understanding, but just the actual hearing the words was challenging.
hmm Yeah, and unfortunately, I think getting older and having more life experience, I completely understand the hearing part. I completely understand the difficulty in doing some of these medicines. So sometimes I think that experience and your own life stage that you're in is very helpful in trying to make sure that we're able to better understand where our patients and families are coming from, for sure.
I have a patient in their 90s who has a great amplifier on their phone. So for like phone calls, it works really well. But for whatever reason, his hearing aids just don't work well. And so oftentimes we'll have this kind of shouting conversation in the clinic. So it's great. I can listen to his lungs. But then I'll say, why don't I give you a call tonight and we can kind of go over everything? And I've found that that's the only way that we can actually end on the same page because in clinic, we just he can't hear me, which is fine, and now I'm aware of, but it created some challenges
Oh,
until I figured out what was going on. And then,
great.
telemedicine is much more of a thing these days, and oftentimes it can be more difficult telemedicine versus in person. Um, are there things in terms of telemedicine that you found helpful?
I do know that, and again, I try not to do as much telemedicine anymore. But some of the places and at the VA, I understand if somebody's living farther away, you do have to do it. So I do always try to have all my pictures of my inhalers ready so that I can kind of show that. Have a lot of the questions that I would just routinely ask to kind of be ready for that one as well. So I think that that makes a difference. But I think that really I try to make it the same kind of visit as I would in a face-to-face kind of visit. So I try not to make it as challenging as possible, with the virtual visits. But I get that sometimes that becomes a problem with the telehealth. Yeah.
Right. So, any take home points that you'd like to give us for as we work with our patients, maybe some of our more difficult patients, things that we should be considering and should take away from this?
Yeah. I think the keys are going to be really remember where we're coming from and when we're approaching those patients and being open minded to that, making sure that we're asking kind of the open ended questions, finding out what are their goals, because it may be very different from our goals. And then making those connections, I think, really do make a difference in trying to motivate our patients or in trying to go through something that might be a little bit of a challenge or a bit of a conflict to better explain what we're trying to do, but always remember to be especially respectful to the patients and families and where they're coming from, because it may be very different from where we're coming from. And then really just try to make those connections so that they trust us in making sure that we're able to kind of offer the best care, and we have their best intent is what we want to do as well. So and that everybody's kind of on the same page in trying to offer that best care.
That's perfect. Thank you so much.
Okay, thanks.
We hope you enjoyed listening to today's episode. As a reminder, this podcast is not intended to provide any individual medical advice to our listeners. We do hope that our conversations provide evidence based information. Any questions pertaining to one's own health should always be discussed with their personal physician. The Find an Allergist search engine on the Academy website is a useful tool to locate a listing of board certified allergists in your area. Use of this audio program is subject to the American Academy of Allergy, Asthma, and Immunology Terms of Use Agreement, which you can find at their website. Please visit quadai.org for show notes and any pertinent links from today's conversation. If you like the show, please take a moment to rate and subscribe through wherever you download your podcast. Thank you again for listening.